Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. TB or not TB, study highlights role of TB risk scoring tool in diagnosis. Researchers have developed a TB risk scoring tool by reviewing past patient data to improve the ability to assess patients for potential TB infections. This tool was then integrated into the electronic health record with the label TB or not TB. The findings are published in Infection Control and Hospital Epidemiology. The tool helps clinicians assess once their TB workup is complete and apparently negative whether infection control precautions can be discontinued, ensuring accurate decisions for TB isolation, alleviating workload, and improving patient experience. The tool has been validated and is now in use at all Mass General Brigham. The research team joined with developers in clinical informatics and digital health to program the scoring model into the electronic health record in the form of tool called TB or not TB. Scale goes up, happiness doesn't go down, study finds. A recent study shows gaining weight generally does not reduce happiness. A decade's worth of data analyzed by a researcher in Germany found that weight gain does not negatively affect life satisfaction. In some instances, individuals who gained weight even reported small increases in happiness regardless of gender or age, indicating that the psychological impact of weight may be less pronounced than previously assumed. Findings are published in the International Journal of Applied Positive Psychology. The study investigated the impact of overweight and obesity on happiness, utilizing large-scale German panel data of 8815 individuals collected across 10 survey waves. The participants were aged between 25 and 60, and the data was collected from 2011 to 2021. The study excluded individuals who were underweight or extremely obese to ensure results were not biased by outliers. Cochrane review shows antidepressants reduce anxiety, but long-term effects remain unclear. A new Cochrane review confirms that antidepressants effectively reduce symptoms of generalized anxiety disorder (GAD) under trial conditions, although there is limited data on long-term usage. The review analyzed 37 randomized controlled trials with over 12,000 participants, comparing antidepressants to a placebo. Most trials recruited adults of both sexes. In most cases, there were slightly more female participants, which reflects the clinical prevalence of generalized anxiety disorder. Results showed that antidepressants were more effective than placebo in reducing anxiety symptoms, with a 41% higher response rate among those taking the medication compared to those taking a placebo. The review found no significant difference in dropout rate between those taking antidepressants and those taking a placebo, indicating that these medications are generally well tolerated. The review also highlights the lack of data on the long-term effects of antidepressants. Most included trials lasted between 4 to 12 weeks with no long-term follow-up. Lancet study pinpoints prenatal vitamins that may reduce infant death risk. A new study has identified prenatal supplements that reduce health risks to small and vulnerable babies. This research was published in the Lancet Global Health Journal. Researchers found that compared to folic acid and iron alone, a multiple micronutrient supplement led to a 27% lower risk of giving birth to small vulnerable newborn types or babies who suffer from preterm birth, low birth weight, and small for gestational age birth, the three groups most likely to result in infant death. Researchers combined 16 different studies and analyzed how prenatal nutrition correlates to the occurrence of small vulnerable newborns. They explored the effects of two additional types of prenatal supplements on women in low and middle income countries. Prenatal multiple micronutrient supplements, similar to a common multivitamin, and small quantity lipid-based nutrient supplements, which provide caloric, nutrition and fatty acids in addition to vitamins. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.